So what's up, guys? This is the Audible Lighthouse, episode 4, being back anyways, and this is Andrew. Andrew is a doctor in physical therapy, brand new, fresh off the shelf.
Yep.
And I'm gonna ask him some questions today about exercise and fitness, because he is a huge wealth of knowledge with a lot of experience. He's got his own little fitness company as well, and it will be a cool conversation, I think. So yeah,
thanks for having me.
no problem. So getting started, let's talk about like your professional journey. Like, what have you kind of undergone throughout the years, like the past 4 years or so? What have you been up to?
The past 4 years, so PT school is 3 years, all the way through. So for the last 3 years, I've been doing that.
Okay.
Prior to that, I was working at the same clinic that you're currently working at.
Yes, so.
In the same position. So I was doing a lot of what you did. So yeah, that's the last 4 years. And before that, I was in school, graduated, wasn't 100% sure what I wanted to do. It was like strength and conditioning or physical therapy or maybe something somewhere along those lines, and decided on physical therapy. So that brings us to now.
Nice. Why do you think it progressed the way it did? Like, what pushed you into physical therapy, like after working as a personal trainer for as long as you did?
So I ended up in 2016, tore my ACL, both meniscus, had surgery, and...
Both meniscus?
Yeah.
At the same time?
Yeah.
Okay.
Same knee.
So lateral
and medial meniscus.
Okay.
Yeah, I was just playing baseball and kind of a freak accident.
Yeah.
But and had a lot of therapy for that, obviously, and that was kind of the last like push to get me towards physical therapy. Had a variety of experience with it before, and I just really liked it. I kind of I guess I don't really want to practice physical therapy in the traditional sense that most people think of when they think of physical therapy. I want to essentially, hopefully transition to the point where I'm more of like a glorified personal trainer, doing more like sports rehab and stuff like that. But for the time being, it's not that I don't enjoy physical therapy in the traditional sense, but I just want to get into that sports field and whatnot. And this is kind of a stepping stone into hopefully transitioning to more towards that, doing like strength and conditioning, rehab, prehab, if you want to call it. I don't really like that word, but it kind of describes what I want to do. So
injury prevention, kind of.
Yeah.
So what was trying to think, how long were you a personal trainer for before you made that jump?
I was only personal training for like a year and a half before I started at the clinic full time. And personal training for me was something that I always like wanted to do, but I didn't really enjoy the place that I was doing it at. And then that was kind of the point in my life where I decided I wanted to go to physical therapy school, and I needed some clinical experience to get me to that point. And so that's where the clinic came in, and that's what I started doing to get some of that clinical experience.
Yeah.
So personal training for me was it was kind of like try it, see how I liked it, and I think I would like it in a different setting. And yeah, like you said, I still do some online stuff and have some online clients and do that. But it's been 4 years since I've done any in-person personal training.
Yeah. That was the same deal with me. It was like, I kind of went PTA and worked in a retirement community in like a gym before that. And then I wanted to be a personal trainer. So I kind of like left PT to go to personal training. And then I found the same thing like where I was. It was kind of a box gym, and I just wasn't enjoying myself or able to help people in the way I wanted to help them. Like, there was a lot of overloads, and like it was also ran by the city, so there was government involved, and it was like just not a fun setting. So that's why I started doing stuff here on my own, and then it just kind of went where it went,
But I feel like that's to get to that point of being totally happy. For me, for both PT and like strength and conditioning stuff, like it's not going to happen until I'm in my own space and have my own clinic and whatnot. So
yeah, makes a huge difference.
yeah.
So what is like would that be like your far out plan, like your next big step you'd say is running your own thing?
Yeah, that's the goal. The other thing about physical therapy is like you kind of have to take a few routes to get your name out there, I guess, as a therapist, establish relationships with physicians or whatever, get some experience, and pay off student loans. So yeah, that's kind of the short term right now is get experience, get to know people, kind of get in that space a little bit, pay off student loans, and then eventually transition into opening up my own clinic.
Cool.
Yeah.
All right. I'll keep that in mind. A couple years from now.
Yeah.
So what was so I know you worked for like 3-ish years and like without being a PT, right?
Mm-hmm.
Okay, so what was the biggest difference in your knowledge then compared to your knowledge now, would you say?
Yeah, I feel like as far as like exercise and stuff, I mean, my knowledge has changed a lot. I wouldn't necessarily say that was because of PT school when it comes to that. That's more of like my own experience following other groups that focus on like strength and conditioning. But from the PT side of it, like the specifics of anatomy, how the body works, the healing process, all that stuff, that's, I mean, you have a general idea of it going into PT school, but it goes to a whole nother level once you're there. Mm-hmm. And you get way more specific, way more detailed, because like part of being a physical therapist now is working in a hospital, so you have to know like vital signs and medication interactions so that your patient doesn't pass out on you while you're trying to walk them down the hallway or anything like that.
Yeah.
So yeah, just like the overall medical knowledge is improved quite a bit. I mean,
medical like vocabulary.
Yeah. I mean,
that's probably a huge chunk of class on its own is like pharmaceuticals and medical terminology.
Yeah. There's honestly not a ton of like exercise intervention that's taught in school. I mean, the thing with physical therapy school is like it's a very general. This is the base knowledge that every physical therapist needs to know to start, and then once you graduate and start practicing, you can kind of specialize and learn, the specific things that you want to do.
That's how PTA program was too.
Yeah.
It's like you learn what you need to know to be able to work in a hospital, rehab setting, or like an outpatient setting.
Yeah.
And then you'll just throw into the wolves, and you know like the very basics, and you either succeed or fail based on your personal skills and like how specific you get into things, basically. Even like wound care and all that stuff, like you guys do that as well. So like learning little bits and pieces of everything, and then you I learned way more the minute I got out,
Yeah, for sure. So yeah, I mean that's the thing with the physical therapy being a doctorate now is like we essentially go through everything that a physician would in school, but they, like I said, we go into like a lot more detail than undergrad. It's like we go through all of it, but then they go through all of it in way more detail. So yeah, I mean, we essentially, like I said, we go through everything that a physician would. We just don't go into it as deep.
Yeah, it's like undergrad, you get like this big look at things, and then when you get to PT school, like you're looking at all of it with like a semi-powerful microscope, and then a physician like spends more years there and has an even more powerful microscope and looks at, but they know nothing. I mean, within reason, almost none of them learn nothing about like exercise and like exercise's impacts on the body, other than that it's beneficial and that's something people should do.
I mean, I think that's maybe one of the spaces that is starting to go on the upward trend. But yeah, that's the thing is like it's there's some physicians out there that you learn the base knowledge in school and then you get out and you find like the specific route that you want to go. And so there's some doctors out there that are huge into like strength training. And
like I was listening to a cardiologist like on a podcast last week, and he's all exercise. Like he does that with all his clients, and he's really good at it. And he's basically like training them, like he's what you said, like a glorified personal trainer. But
yeah. So it's kind of the trend of the market, I would say.
Cool. And would you say, like, do you feel like you already have your specialty, or do you think that's still like yet to be discovered?
Yeah, I mean, I have this idea in my head of like what I want to do and how I want to go about it. But that's the thing, is like it could change as things go on. You know, like I think the sports field and physical therapy in particular is pretty niche, and so you kind of have to know people and whatnot, which is unfortunate. Or you like do a residency for that, and
or you just get lucky.
or you just get lucky. So yeah, getting into that is like, you know, that's the idea that I have in my head. But if the routes don't line up or whatever, you know, that's the nice thing, is there's a lot of different options. So yeah.
Interesting. Cool. Getting into a little bit about just exercise related topics that only a PT would have the knowledge of. How do orthokinematics, like how can you explain that for dummies, and how can they potentially use that information in the field of exercise?
So orthokinematics essentially is talking about the interaction that happens at a joint with certain movements. So if you take the shoulder joint, for example, and we're looking at abduction, which is the arm coming out to the side, there's the concave glenoid fossa, which is on the shoulder blade, and then the convex head of the humerus. As the head of the humerus is moving on that concave surface, there's a roll that happens upwardly and a slide that happens down. So I don't know like the specifics of how it can really play a huge role in exercise. How we think about it is like mainly when it comes to manual therapy, like hands-on stuff, like frozen shoulder, for example. If someone has frozen shoulder, typically they're limited in external rotation more than they are abduction, and abduction more than they are internal rotation. But those are the three movements that typically are limited at first. So for
flexion,
I mean, at a certain,
I have a guy right now over on the Gonstead side of things who can come to like 90 degrees abduction and like 120 of flexion, like about right here. And then he has like no external rotation. It's like a similar pattern, but flexion's limited as well.
Yeah, I mean, at a certain point, if if those three motions are limited, then everything else is going to be limited. But what we look for clinically is the capsular pattern, which would be external rotation, abduction, and then internal rotation. Okay. So like external rotation, for example, if we're trying to stretch the capsule and improve its ability to allow the humerus to go into external rotation, then we're going to do like some joint mobilizations forward, so like in an anterior direction to kind of stretch that, because the roll is happening posteriorly and the slide is happening forward. So the thought is if you stretch the anterior capsule, then that will open up that motion. And yeah, that's arthrokinematics in a nutshell. Their direct application to exercise, I don't really know if that, because most people, when they're exercising, they can't really manipulate the slide.
So how I've seen it used is banded mobs, like like using a big monster band and then either distracting the joint, like so that there is more room to move, or you can actually like slide it backwards, like have it apply pressure on the front, pulling it back so that you can move better and like the movements that require it to slide back,
Yeah.
So like with So like with abduction, like if somebody has a little bit of pain or they feel like a limitation at the top, like is there application, or could you like apply downward pressure with something to make it like feel better potentially? It's kind of what I was thinking.
Yeah, and you know, there is some of that. I don't get into a ton of it with the bands, but yeah, you can do that. I think the big thing for most people with stuff like that is using the band to get some sort of distraction in the joint.
Yeah.
Because usually joint distraction feels good for everybody.
Yeah.
So the one that I think of oftentimes is I'll see people like if they're trying to open up their ankle, for example, they'll tie a band around like the low part of an upright on a squat rack, and then they'll put it behind them, and then they'll bring their knee forward so that they're increasing dorsiflexion. But technically the arthrokinematics of the joint, you would want to pull the tibia backward.
Mm-hmm.
Yeah, you'd want to pull the, I had to think about that for a second. Yeah, you want to pull the tibia backward because it's a convex joint moving on a concave surface.
Yeah. So the tibia is being pulled backwards though, right? Like if you place the band.
If you're facing away from the squat rack, but I've seen it where people
you've seen it the other way?
Facing towards, yeah.
Okay, that's right. Yeah.
Because they think that they're like, oh, I'm pulling my tibia. Well, and I guess technically like because
I've seen that like with TKEs, but that's higher up, like up in here too.
Yeah.
Which that's fine, but you've seen it like people placing it downhill, pulling them forward.
Yeah, I mean I've seen people doing it everywhere, and yeah, the thing is, you could make the argument for the other thing is like
it's pulling you into the stretch.
Well, because and you're technically in a closed chain position, so then your ankle, your talus isn't moving.
You're getting real deep now.
Your tibia is the one that's moving, so then it would be a concave surface moving on a convex.
Okay.
So yeah, that's why I don't think it's like it really makes sense to get like as specific as they talk about sometimes, because it's like in most applications, if you just change like one thing, whether it's like open chain or closed chain, like you can make an argument for it the other way. Yeah. And honestly, that's like most of PT school is like you get taught a certain way, but a lot of your professors are like, yeah, this is how I do it. This is my preferred method. If you have reasoning for another way and it makes sense, then it's good. Yeah. So
I can speak to that too, because like I worked in an outpatient clinic. I bounced between 3 of those clinics actually, and every clinic had like 6 PTs, and I was the floating PTA. So like I had to know a little bit about how everybody was treating, and every single PT like went about it a little bit differently. Yeah. Like some of the protocols were similar because it kind of has to be like for post-surgical, but if it's like somebody just coming in with like general pain, I saw all sorts of stuff, Yeah. And most of them work too. It's just a matter like everybody goes about it different ways. That's for sure.
Yeah. So yeah, I think if someone wanted to be consistent about it, you pick one way or the other and figure out which works best for you. Yeah. I mean, that's what it comes down to is like
what gets results.
Yeah, it doesn't really matter what the science says or like what this person says is the science. It's whatever works.
Yeah, that's true. So yeah, in some way I'd say like banded bows have pretty limited application. I think distraction is probably the most effective. And then I also feel like it helps me with my shoulder. Personally.
Yeah.
And I've seen it helps some people, but
exactly.
It's like a really niche thing. It doesn't really need to be done unless you need that kind of priming work prior to your lifts. Like I get pinching in my hips, so I do distraction on my hip prior to squats, and then I usually feel a lot better.
Yeah.
So I guess we already talked about what got you into the field, but can you talk a little bit more about like your specific rehab, how that went, and why that? Because I got into physical therapy for the same reason, tore up my knees, did like 2.5 years total of rehab.
Wow.
So that's what made me want to go into it, is like I saw how sucky some of the high schools were doing at like teaching kids how to move. And then also like they kept getting me to a certain point and then releasing me. And I was never actually better, you know. I didn't have the tools I needed to succeed for my whole body, so that's why I kept getting all over the place. So that's why I went into it, is I wanted to be like a resource for people, not only to get better, but to move beyond better so that they're less likely to get injured in the future, and really address like the whole of their movement, not necessarily like the little niche areas that need specific training like that the PT can do, but I'd love to work with them afterwards, you know. So that was where I went with it. What about your rehab made you want to go into physical therapy, I guess?
Yeah, I mean, specifically, I didn't really think about it in that way. I was fortunate in that when I tore my ACL, had surgery, it was while I was playing sports in college. So like, I had not only like my own insurance to cover it, but the school's insurance as well. So like, I was able to get a decent amount of rehab. And then from there, one of the strength and conditioning coaches at the school kind of took over and basically took me through that whole process of like making sure that I was fully recovered. Because
that's what I did. I got full therapy. My knee got better. Like I cleared all the things that needed to be passed. But then they would just release me back to the people who kept hurting me, you know, and not giving me like what I needed to keep that from happening, I guess. But,
So yeah, that brings up a whole different animal, like talking about insurance, and that's unfortunately, you know, where some of physical therapy is limited, is like once you reach certain markers or like a certain point in therapy, your insurance stops caring, and they're like, yep, you did it, you're good. And so the therapist is like, I either discharge you or I'm giving you services for free. And like, that's just, I mean, that's just not sustainable for the therapist, and also it's like just not a good model. So yeah, that's where like, I mean, hopefully my idea is like having a gym with a physical therapy clinic in it. And you know, I would like to see more people doing this. There's some people doing it now, but you like take them through the rehab process after an injury, and like once you get to that point in therapy where the patient is better and they're discharged from therapy, like if you are doing your job as a therapist, then you can, you know, the patient should see that like, hey, I understand that my whatever was hurt is better, but I want to get back to playing ultimate frisbee on the weekend with my friends and I don't feel like I'm there yet. Like offering some sort of service that's not insurance covered, that's totally like, it, you know, again, more like glorified personal trainer, glorified strength and conditioning coach. But you offer that as like, hey, this is, your rehab is done because whatever was injured is now healed and you've met certain criteria, but you're not fully back yet. Let's get you back there, do that sort of thing. So yeah, that's, I mean, I never really had, like, that's kind of the experience that I had, and I never really thought about it. But that's just like one of the problems that I see with rehab is that. I think it's a huge missing piece.
Yeah, and I think if they don't do the gym thing, then they should at least give like a forewarning or let them know like they're going down the wrong path, you know. And I think like just being a resource throughout the process as well, like being around your patients and explaining to them like how this could potentially happen, and like when you see them do a squat and they have like a bit of a pronation, just addressing it there, like not really being passive with it, but being really invested in the person's health, not only while they're there, but after they leave too. Which is also just being a good, effective PT, I think. And I think my PTs were pretty awesome people, and they were the people who made me want to go do it also, because initially it was more so that I just enjoyed the process of getting better.
Mm-hmm.
I didn't really realize and see like the patterns of me re-injuring and like those things happening until a lot later. But
Yeah.
So with your knee rehab, what is there anything that still lingers with you? Like, have you made a full recovery, you think?
So yes, but my medial meniscus, they put some sutures in it, tried to repair it, and usually with those, if it doesn't heal like 100%, it doesn't heal. And so that's the case for me. I still have a torn meniscus. I had an MRI probably like a year and a half later. You could see it on there. So when I'm squatting, every time I hit like 90 degrees, there's a click in my knee. Certain times when I'm walking down the hall, there's a click, but I have zero pain with it. It's just there. And yeah, that like, it's honestly been really beneficial. Just as a student being in the clinic, like you'll hear people say like all the time, oh, my knee is clicking now and I never used to do that before. And the knees are a weight-bearing joint that doesn't have a lot sitting in between those two bones. You know, that's why knee replacements are so common, and one of the most common joint replacements is because your knees take a lot and they just eventually wear out. But you know, when I have a patient in front of me that's like, my knee's clicking, why is it doing that? And they're like really focusing on that, I can be like, you want to feel my knee? Like I'll squat down and show you what my knee does when I squat. And they're usually like, oh my gosh, that's disgusting. I'm like, yeah, but it doesn't hurt. Like I can live with it. Like if you focus on those little things, then that can perseverate and like just prolong the process of your rehab.
Yeah. It also like, I've seen it a lot where people so intensely focus on their pain that it just feeds, like it's like a cycle and it grows into this massive beast when it was like a pretty small thing.
Yeah.
And like you can provide like the simplest placebo effect, like tape. And not that tape doesn't work and have application, but like if you tape those joints, they'll just like, all that massive monster pain is just gone. It's like, probably not. It's just like you're getting more comfortable with it, you know?
Yeah. And you know, unfortunately, again, with insurance, like getting pain level in rehab is, you're like required to. But some people, I eventually just like stop asking them if they have pain because they'll say everything hurts. And then as soon as you stop asking them if something hurts and you like take them through a couple sessions, you're like, yeah, I remember when you couldn't do that before, but you're doing it now. Yeah. They're like, oh, wow. And you just like, if you totally redirect their thought process on pain, they usually are like, oh yeah, I can do this just fine.
And move towards like steady progression and like I have a client like that, or I did have a client like that who was really, really intensely focused on her pain, and like every single joint she had problems with, like I'd be like, does that hurt? Yeah. Does that hurt? Yeah. Does that hurt? Like everything, right? And she got into strength training, was doing a little bit, and I noticed pretty quickly that I needed to stop asking her those questions and just like point out that she was getting better. It was like, look at this. Look at how you did this on day one. This is how you did it. And I'd show her and I'd be like, now look at you do it. And she's like, oh yeah, I'm way better. You know, and it's like she started to be empowered and able to do more at home and stuff too, which was cool to see.
Yeah. And like every single person on the planet, every normal single person, like they have pain, they have aches. Like just yesterday, I just had this spot in my back that was just kind of like, I could feel it. It was there. It was a little uncomfortable. And I was going to golf, and so I stretched it out and whatnot. And it's like, if you're 100% pain-free, like that's very rare, and like you need to have your DNA duplicated or whatever. Like, I have some people that come in and they're like, well, I was like sitting, bending over, pulling nails out of a board, and now my back hurts. And it's just like all because of this. I'm like, if I was sitting over in that position, pulling nails out of a board, my back would hurt. Like, you know, it's one of those things where people just focus on the pain so much, but it's really like, when you do that, it's more debilitating than anything.
I think it's also important to understand that those different levels of pain, like, and different perception of those levels. Like everybody has their own perception. Like three people could have the same exact issue, and one person could be like screaming and like suffering, and the other dude could be like walking around working a full day. You know?
Yeah.
And like pain is also your body's way of telling you that something's wrong. But that's not like in regards to muscle soreness or like aches or anything like that. Like my neck's sore right now. I don't think that doesn't mean that I can't like do stuff with my arms and like go lift weights right now. I think that's just regular pain, like you said, because I was typing all morning.
Yeah.
But if you like go to do a squat and you feel horrendous pain in your left knee whenever you get past a certain point, then obviously don't, like, we're not telling you to just keep doing that over and over again either, because then you're going to modify your movement pattern, shift your weight off of that knee, and then continuously do that over and over again, and then create a bunch of problems elsewhere. So you need to listen to those big signals, but the little things that happen like in day-to-day life isn't as big of a deal, I feel like.
Yeah, and I mean, not that it's like a cure-all, but a lot of times those little aches and pains are just like not moving.
Yeah.
I mean.
Oh yeah.
Yeah, like
Big
it's
time.
crazy how a lot of patients that I've had, like I said, just as a student, like they're like, oh man, I still got this thing that's bugging me. I'm like, okay, let's just get you moving, stretch it out, get the muscles working around there, and then they're like, I'm good now.
Movement's the best medicine.
Yeah.
Motion is lotion.
Yeah. Yeah. That one makes me a little uncomfortable.
Motion is lotion. How much priming do you do, or do you find yourself doing prior to like your big lifts? Like, I know you lift mainly barbells, like before squats. How much work do you do before squats, or are you like the kind of guy who's like, I'm just gonna do light squats a bunch of times, and then my squat will be good?
Yeah, more the latter. I have like a general warm-up routine that I go through where like I usually foam roll a little bit, mainly just like thoracic to kind of get that loosened up, and then I do Spider-Mans. Do you know what those are?
Spider-Man lunges, like where you do a push up and then you move your foot next to your hand.
Yeah, I don't do a push up.
And then drop your knee down.
Yeah.
Well, I got you. You're in plank position, like full plank.
Yeah, same thing. And then I usually do like a thoracic rotation with that one.
Yes. Yeah.
Kill two birds with one stone.
Yeah, that's great.
And then
smart guy.
usually after that, even on my upper body days, I grab like a 30-pound kettlebell or like a 25-pound plate, and I just sit in a deep squat for like 1 to 2 minutes.
And shift like side to side and stuff.
Yeah. So yeah, I do that and kind of stretch out, and then I do some band work like for shoulders. And then I just go into like, I start with the empty barbell on every lift except for deadlift, just because it doesn't really make sense. And do some reps and
you can maybe do like crazy eccentrics for your hamstring.